Hello and welcome again to the live broadcast from Innovation Tel Aviv. Today with us is Professor Roee Landsberg from A.R.ם, the Center of Otolaryngology in Tel Aviv, in Asuta. Welcome, Professor Landsberg. Thank you for joining us today. Please introduce your topic and we will be happy to see your presentation as well.
Okay, thank you. I guess we can start right away with the presentation, right?
Yeah. Mm-hmm.
Good morning or good evening, good afternoon, everybody. And I think I'm there. All right, is this okay?
Yes.
All right. So my name is Roee Landsberg. I'm one of the founders of the A.R.م Medical Center. Center of Otolaryngology, Head and Neck and Maxillofacial Surgery, or as other people call ENT, ear, nose, and throat, and the associated surgery. What you see here on the left side is our group, A.R.м, the doctors. In this picture, you see in the middle, you see a picture with our waiting room. You see everybody sits on a bench. The idea is being one level, all of us, the doctors and the medical staff as well. And on the right side, you see Asuta Medical Center, that's our building. So what is A.R.M Vision? To provide comprehensive, professional, and personal treatment, to be a national leader in A.R.m's areas of specialization, to be updated via peer learning, conferences, and research, to innovate medical and social aspects in full synergy, and to lead international collaboration and worldwide medical services. We had a very special experience last year in August. A.R.ם, most of us, sent a group to China, a voluntary delegation. It was including surgeons and medical staff members, most of our employees, which are our partners actually. A.R.м visited both Shandong and Fujian provinces, public hospitals, and medical centers. I was in Zibo. We had a very unique experience there. We participated or led actually complex surgeries. We gave some medical consultations. We led and attended professional conferences. And we were deeply involved in quite a lot of social activities. So we had a lot of fun and very deep and interesting professional experience with our colleagues in China. And we enjoyed a lot, and we earned a lot from this, I mean spiritually. And we are always open for new international collaborations. So our topic today actually is telemedicine. Telemedicine for nose and sinus patients. Does it work? So besides founding this group with my two partners, I'm heading here the unit of endoscopic sinus and skull-based surgery, meaning dealing with the nose, septum, turbinate, sinuses, base of skull, and everything that we can approach through those nerves with endoscopic tools. What is the definition of telemedicine? The use of electronic communications technology to provide and support healthcare when distance separates the practitioner from the patient or caregiver. So what was our study question? Because we conducted a study here. So for the nose and sinus patients, and my field is rhinology in brief. If you see this word again, rhinology is, the medicine of nose and sinuses. So this is the question, can telemedicine really replace frontal appointment? Meaning talking or looking at the video instead of going to the clinic. So we have several different types of telemedicine, as we all know. Audio, that's a telephone. Audio visual, it could be Skype, WhatsApp, or FaceTime. And what we use today is, most of us already know, advanced audiovisual conferencing. And we use quite often the Zoom, as you probably know. So obviously, the Corona crisis significantly leveraged the video conferences. And as you can see here, for instance, what you see here is our group. These are most of the doctors. And we're running, what is telemedicine? Is it new? Well, there are multiple articles on telemedicine, about 35,000 in the internet. There are associations of telemedicine, journals, and we can read a lot about dermatology, pathology, radiology, internal medicine, orthopedics, pediatrics, neurology, emergency, but no rhinology, not what we're talking about today. So what is our protocol for telemedicine? The first option to the patient is a frontal appointment. Then if he wants, we can provide this option, the second option, remote consultation. And many people these days will go for it because of Corona considerations or distance considerations or just to speed up in the waiting list. So patients are invited to Zoom's waiting room about every 20, 30 minutes. Patients are sending CT or MRI images through a link by an imaging platform. Relevant clinical pictures or videos are preloaded at the physician's side, my side. I can load it on my computer. And then we have the conversation part with the patient, screen sharing or relevant pictures, discussion, we can have a plan. And at the end, we give summary, letter, and we send prescriptions as needed. This is, for instance, a way that we have. This is a bit of my Frank computer. The patients can send to us the CT scan through a link. This is a special software, and it makes the sharing of this imaging information very comfortable. As you can see here, in several seconds, I can show the patient everything on his CT scan or MRI, and this is very comfortable. Here, for instance, that's the way this is my room setup. As you can see, this patient, for instance, I can talk to her, I can see her, and as you can see right now, she shows me on her face where the pain is. So this is like sitting here in front of me in my office. And in this patient, we can see the way I can share with him his CT scan. I'll jump, and this is the CT scan of him. He can see it right now on the screen. I can really show him with my mouth, exactly with the mouth, where is the problem, where is the infection, and what do I need, and what does he need, in my opinion. And this is a very clear picture that gives me a lot of information. And I can preload, as I said, a lot of information. I can show the patients this scheme or illustration of the nose and sinuses and explain to him where everything is. Well, if he wants, I have other things to show him right away. This is the way the surgeon looks at the OR, with the endoscope and the main instrument. This is on the right side, that's a picture of the operating room with a camera, with a video, and with a navigation system and stuff. Here we can see the screen of navigation system. Navigation system is like a GPS that I, as a surgeon, for safety and accuracy, I can see on the screen exactly where is the edge of my tool, because I don't want to hurt vital structures, such as the brain, eye, so on.
לא רואים אבל שומעים.
אתם לא רואים אותי?
לא.
אתה רוצה שאני אמשיך?
כן, כן, כן.
אבל לא רואים את התמונה שלי?
No, we can see the presentation. We can't see your we see the movie. Okay, so we can.
Keep on.
Okay.
All right. So on this picture, on this short video, if somebody wants, I can show him the way I operate. For instance, the septum. As you can see, this is a cartilage, and that's the way I cut it. That's if the patient asks to see it. If he doesn't, of course, I will not show it. Here, I can show the way I reduce the size of the turbinates. This is the inferior turbinate. That's part of the vital structures of the nose. And here, I can show the way I remove a polyp. Okay, this is the endoscope on the left side of the nose, and I take that thing out, and this is a clean sinus, and the patient will breathe normally from now on. This is if the patient is going to have endoscopic, if he has a hearing problem, too many tears because of nasolacrimal duct obstruction, hearing system obstruction. That's the way I can open the tear sac from the nose. So I can approach the eye from the nose. And this is if somebody has quite a severe problem of having brain leak, fluid leak from the brain to the nose. I can really still it. I can stop it because it might be a dangerous situation for the patient. He might have meningitis. So you can see here the way I approach is the base of skull, and the green stuff is the fluid from the brain actually, which I'm going to stop. Sometimes it happens inadvertently, dental implant endoscopic removal from the sinus, which is what you see here. That's an implant that the dentist somehow managed to push it into the sinus, and we have to get rid of it, obviously. And this is another example of the way we approach empty nose syndrome. Empty nose syndrome is a syndrome where we treat many patients which have a severe breathing, nasal breathing problem, and mental issues as well after having too aggressive surgery. In this case, you see that I put inside an artificial turbinate that we here developed. It's going to be internationally known. So what were our results? We had 14 patients so far because we just started at the Corona era. We had about 14 people. The mean age was between 27, the range was between 27 and 72. 12 patients were new. Imaging was available in 69% of the patients. Mean duration of the telemedicine consultation was 15 to 25 minutes. Only 5 patients were invited for frontal appointments. 3 of the 5 were scheduled for surgery. So I could have all these decisions just by having telemedicine without the need to see in front of me. And in 9 patients, 65%, neither office nor telemedicine was further required. So we could really skip it. You can see here, young people as well as elderly can quite nicely cooperate with this system. Various symptoms that I could hear in this group of patients: nasal discharge, nasal obstruction, facial pain, loss of smell, cough, bad nose odor, and lack of symptoms. What were the diagnoses that I could provide them? Chronic sinusitis, deviated nasal septum, obstructive inferior turbinates, sinusitis following dental procedure, suspected upper jaw inflammation here, suspected sinus tumor, and sometimes no evidence of the disease. I could get all this information just by this video conference. I could recommend the various kind of treatments: nasal spray, anti-allergic medications, antibiotics. I could refer them to imaging like CT or MRI, surgery or biopsy. I could ask them to come still to frontal appointment because maybe the physical examination is needed. I could refer them to other subspecialty, and I could give them a clearance for various activities like specialty course. When we did give them questionnaire after that, and as you can see, not at all is 1 and strongly is 5. So for most questions, they were very satisfied. Like remote consultation saves time, yes. His physical examination was not essential. They agreed, most of them. Did they trust the doctor or the process? Yes. Well, his remote consultation is better than office consultation. Mostly they said yes. But if in the future, will they prefer remote consultation? Well, they said 3 because most of them they still thought that maybe just being in the office is better. They may be right, but sometimes what we can do and what's available is remote consultation. Do they prefer video over phone consultation? Yes. And are they satisfied for remote consultation? Yes. So this is encouraging. So what were our conclusions? We conclude that the telemedicine saves time and costs. Patients in a wide range of ages incorporate in telemedicine. During an endemic era, telemedicine is safer. and masks are not needed in the corona time. That's cool these days. We don't like those masks in front of the patient. In most cases, diagnosis can be made with good certainty, and telemedicine may be a good substitute for frontal appointment. That's the main conclusion. So what is all that thing about physical examination? Because it seems to be like a crucial part of every doctor's visit. Well, it is very important, but we discovered by doing telemedicine that not always we can really survive without it in most cases. So it's not that bad. So, two examples on the left side, well, we cannot come from the screen and really check the patient. But on the right side, you see a patient on the Zoom, during Zoom, on the screen. I asked him to raise his head upwards, and I looked into his nose, and I can see from here already what is his main problem. Yes, he did a nasal septum. So I could see by the screen and give him further recommendation. And another example is this patient who complained of bad odor, that smell from his nose. Now, he had, before that, he told me a dental procedure. It is very clear what I see in his CT, and I showed it to him during the conference with him, that he has integration of dental implant into the sinus. This is what you see here, and it's surrounded by severe infection. And this is definitely a reason and indication for surgery. So I could know everything from here, and the next thing, get surgery 1 week later, is not perfect. So, just to give an example how progress could be at the end, at the future. This picture on the left side, a patient sent to me about 2 weeks ago of his interior of his nose and sinuses, and they even circled this area with the black line, and asked me, "Is this okay, doctor?" He sent me to me, digitally. So I told him, well, yeah, it doesn't look good. It doesn't look good. Something is wrong. But how did you do it? How did you manage to stop yourself inside? So this guy, very simply, he bought in the internet, Alibaba or something. He bought 4 meters of flexible endoscope. It's actually built for plumbers, okay? But no problem. It worked perfect. He used it, put it in his nose, and I had the diagnosis. And probably things will go better and better. So, if we summarize in one page, in one sentence, in rhinology, telemedicine is here to stay, definitely. Thank you very much for listening to me. I'm done.
Thank you very much, Professor Landsberg. This was an amazing presentation. It's a fascinating new world that we just started to realize now. And I wanted to ask you, first of all, thank you very much. The presentation was very enlightening, and the stories are amazing. Regarding this technology, this technology of filming in video the surgeries, of course, you do it for several years, not just because of the coronavirus, but we use video in the surgery, in the operating room for a few years now. Can you say something about medical education? You talked about patient education and how you use video to explain to the patient about procedures. Do you use videos as a mean of educating the students and the fellows in medicine? And what kind of usage do you do with this technology?
Yeah, absolutely. We use this platform intensively for teaching. Here in A.R.م, we have medical students several times a year, groups. They come for 2 weeks, 6 year of medicine students. In addition, we have fellows. We have young specialists in ENT and neck surgery, or in my field, and they come for 2 years to learn those skills. Now, of course, they share here the clinics, the operating room, a lot of research, but a lot of video, we share with them a lot of digital information, images through the same Zoom or other platforms of video conference. We do all our, we have a small group here of 6 rhinologists in my field, about every 3 weeks, each one in his house. We share special cases, any problems, we advise on each other, we try to learn one from each other, and it's a great tool. We use it quite intensively, and it will be more and more this way.
Great. Okay, I have one more question from the audience. By the way, we have a lot of people in China watching us right now in Baidu and other applications. I have one more question from the audience. Did you get any refusal from patients that didn't want to use this new technology and insisted on visiting the office and not use the telemedicine? And what were the reasons for this?
Yeah, absolutely. You know, let's not pretend. I mean, the gold standard, what we say, is to come to the office.
Yeah.
And I can touch him, I can look inside and see exactly what's going on. But so most of the patients will prefer that. When will they prefer the telemedicine? When they live far away, when it will save them time, when they will, it will help them speed up their waiting list.
Yeah.
You know? Instead of several months, being here in 2 days,
yeah.
That's an advantage, absolutely. And well, as I said, I'm very surprised by this way to see that, no, I don't have to see all of them in the office.
Yeah.
I like to, I love it, but I don't lose much information, but just talking to them through the telemedicine.
Yeah. So I guess this is one of the good things that we got from the COVID-19 pandemic. We can see some good things that derive from this horrible disease, but I guess that telemedicine was one of the things that we learned during the pandemic. Thank you, Professor Landsberg, again for your very amazing presentation, and I hope to see you again by video or in person. And thank you very much.
My pleasure. Thanks a lot to you.
Bye-bye.
Bye-bye.